So let us assume that you start treatment of a patient with uro-oncological disease who starts treatment with IO by today. How high would you rate that this patient, in the case of a severe immune-related adverse event, does not get the proper treatment that he needs due to missing capacities in the times of IO? Maybe we start with Dr. Fund in New York City. How is the situation at your guys?
Yeah, I'm going to show some slides now shortly about the situation in New York. But with regard to your question about whether or not we'd be able to care for a patient with immune-related adverse events, I think we are in a unique situation at Memorial Sloan Kettering Cancer Center because we're a closed cancer center where we only care for patients with oncologic diseases, unlike a lot of our colleagues at other hospitals throughout the city that have open emergency departments. So right now, I think we would be in a situation where we would be able to certainly care for a patient. We have today, right now, have the ability to care for patients in our ICU and so forth.
Okay, thank you. Petros, what's the situation in Seattle?
I think that the situation in Seattle overall, Tillman, has evolved, I would say, more favorably compared to what we had expected 2 months ago. There was a very nice publication in the Journal of NCCN by Dr. Masumi Ueda, Mark Stewart, and other colleagues of mine about 6 weeks ago or so, just showing our preparation for the surge and the peak of COVID-19 pandemic. However, over the last, I would say, 2 months, the actual reality was much less intense of what we had expected. So we still have capacity to the ICU to take care of those patients and deal with this situation. Of course, this is not the same, sadly, in other places. We know that, places like Milan, New York, have hit much harder. So I know the capacity there is much more of an issue. And we're going to talk in more detail about all the steps that we're all taking. But so far, the situation here seems to be manageable, and we have not hit capacity. We still have cases, of course, but we still have capacity, and there is no need for rationing so far.
Thank you. Professor Gschwend, how would you rate the situation in Munich?
The situation is not so bad in Germany by now, and it wasn't really bad in the last couple of weeks, because we have a real good capacity for intensive care unit beds. And actually, I guess about, and Peter will show us the data later on, but actually we have many ICU beds not used by now. So we have a chance to get every patient that needs intensive care to get a bed and to be treated accordingly. So if a patient comes back with any side effects that needs intensive care treatment, it is by now no real problem to bring him to an intensive care unit. Because we have a very high capacity, so we were urged to really hold a lot of beds free for possible COVID patients. And in the worst days, we had about 45 patients with COVID on intensive care unit. By now, we have a bit less than 20. So there is still a lot of possibilities.
Okay. Peter Hammerer, would you agree with this opinion on the situation?
Well, Jürgen is in the southern part of Germany. I'm in the northern part of Germany. Here, I think the situation is also getting much better. 2 months ago, we were actually postponing active cancer treatment because we were really afraid. Now, by law, we have to keep about 25% of our intensive care beds free for possible cases. And I will show you some data about the intensive care capacity in Germany. And now it's okay. We have free beds, and the situation is not really so bad as we expected. So now we are really treating everybody who needs treatment.
Andrea, Milano is in a region of Italy that has been heavily affected by COVID-19. So Lombardia was one of the epicenters, or has been one of the epicenters for the disease. So how is the situation right now at your center for patients starting IO treatment?
Yeah, we have been the first hit in Europe of the coronavirus. Since mid-February, we started having something like 400, 500 deaths per day in Milan and in the Lombardy region. So we are just out of the earthquake, and we are seeing some light at the end, some ability to reshape the things and to recover to normality. But the most important issue now is, coming back to your question, is about the quantification of the safety of administration of drugs, chemotherapy or immunotherapy, like in this case. But I think that we cannot have any reliable idea until we'll have the results of the widespread use of serologic tests. So we started using and offering the serologic test to all people and healthcare professionals to have an idea of the widespread, or the spread of the virus actually, and the level of immunity in the population in general. And without this information, I think we will not have any truly reliable idea on the risk that the patient have in receiving any kind of treatment, in particular immunotherapy. Based on this, we will still prefer, as I will show in the slide later on, some sequential strategy more than combination strategy. But this is only an assumption pending the actual data that we will collect.
Okay. Professor Xing, how is the situation in Beijing?
Yeah, thank you. So far, Beijing almost come to normal. Since the outbreak of the coronavirus, the epicenter in China is in Wuhan, and the city was locked down and for a long period of time. And after that, it's open already. And in Beijing, we don't have too much actually the COVID, the disease. In our hospital, we don't have even one patient. But we really took a very strict measures to prevent the infection or the spreading of the virus. Very strict. And also and our operation in number reduced a lot during this period of time. But for patients who need care, for example, the invasive bladder cancer, we use a new adjuvant chemo and the immunotherapy. So in order to avoid delaying, for the treatment of the patient.
Okay.
We come to normal.
Okay. So,